All right, welcome everyone to a new episode of the Roscoe's Wetsuit podcast. I am with a very special guest today. I have Dr. Richard Sherman on the show. Dr. Sherman received his PhD in psychobiology from New York University in 1973, and then he went on to do postdoctoral clinical training in psychophysiological treatment techniques at the VA hospital in San Antonio. He currently directs both the psychophysiology doctoral program at Saybrook University in San Francisco, along with the Behavioral Medicine Research and Training Foundation in Squamish, Washington. His research has been best known for identification of physiological mechanisms causing phantom limb pain and treatment of migraine headaches with pulsing electromagnetic fields. His research has been supported by grants from the NIH, the VA, and the US military. Dr. Sherman, welcome to the show.
Thank you very much. Looking forward to this.
Absolutely. Great. Well, I wanted to, start off just by asking you what originally sort of piqued your interest in the field of kind of psychobiology or neurophysiology?
Um, there's a huge problem in clinical areas where we can't tell what's causing various diseases, chronic pain problems, things like that. So I began looking at psychophysiology as a way to tease out underlying problems. And it turned out that really there's no other way sometimes to figure out what's wrong than with psychophysiological recordings. So I got more and more interested in that. And then it turned out that psychophysiological recordings can be used to guide interventions, for optimal functioning in coaching in sports or education or clinical areas. So I became more and more interested in interventions that are based on psychophysiological recordings. So I got sucked in deeper and deeper. And then as I became a professional military officer, the military decided that this was a really good way to assess what was happening with soldiers. So whether I was interested or not, there I was doing it and did it for about 22 years.
I see. So
That's the
before
progress.
before we go any further, can we just kind of break down, I guess, sort of what biofeedback is, but also just kind of the other, whatever sort of biofeedback treatments that you've been working with or that you've found efficacy for, as your research has evolved?
Sure. We have to take this in two parts, though. Psychophysiological recording is a standard process. It's used in research all over the world. It's used in virtually every major hospital system in the world. For instance, sleep labs record your brain waves, your muscle tension, things like that. So psychophysiological recording is sort of part A. You use that to figure out what's going on, and then you can apply interventions such as biofeedback to help people learn to correct the problem. So biofeedback is a teaching process. It's coaching people to recognize a physiological system that's not working properly, and then they learn to correct it. In other words, with biofeedback, you have a psychophysiological recording in real time. You see what's going on in your body. You learn to recognize patterns, and then you learn to correct them. A real simple example is when you look at somebody's face, very often you'll see that this part of their face is kind of large, and it's because they keep the muscles around their jaw too tense for too long, and that causes all kinds of jaw pain and then headaches. And it's a habit. There's nothing actually wrong. You just have to get the people to recognize that they're staying too tense for too long, and then to relax whenever they become too tense. And so that you use the signal so that people know when they're too tense, and then they learn to habitually relax whenever that happens. In other words, it becomes unconscious.
Hmm.
So
So you
you
can
were
use
asked,
this, yeah, you can use this for for kind of dissolving muscle tension. What other sort of physiological mechanisms can we sort of, I don't want to say get in the way with, but sort of, self-correct and take control over?
um, so for muscle tension, let's say that somebody has low back pain. Most of the time, you actually have no idea what's causing the low back pain. So a psychophysiological recording of somebody's muscle tension at different levels of pain can tell you what the musculoskeletal component is. In other words, too much tension causing the low back pain. And then you teach somebody to control that. But if part of the pain is due to arthritis, you won't change that component. Um, so muscle tension from jaws, the back, um, problems causing tension headaches, that's all related to muscles. Another one related to muscles is urinary incontinence. There's vast numbers of people who have urinary incontinence. For instance, a great many women don't participate in sports because when they get very active, they squirt. So you can teach them not to, and you can objectively track how well they're doing. So that's all muscles. Um,
Interesting. So your job, you kind of have to tease out whether, a person's problem is caused, by this sort of muscle tension, or if there's like an underlying, inflammatory issue, like
that's right.
arthritis you mentioned. Um,
Yeah,
what about cases, where there's been, say, some kind of injury, say there, some kind of back injury, that's maybe not healed completely, or people are still experiencing pain, like chronic pain down the road. Is it possible that like part of it is something that can be under voluntary control, and then part of it isn't, or how do you see that?
that actually, I didn't even finish answering your last question about what other things we
Yeah,
record.
right. Yeah, if we want to start with
Let
that,
me,
yeah, we
let me finish that.
sure.
Patterns of blood flow in the body are very easy to pick up because virtually all of the heat that's coming out of your skin is caused by near surface blood flow. And if there's too little near surface blood flow, you get pain. Your limb begins to hurt. Um, so for problems like burning phantom limb pain, that's caused by too little blood flow uh, in the part of the limb that's been removed. So we record things like that. We can figure out how much of burning phantom limb pain is due to a problem with blood flow, and then how much isn't. For instance, we can use brainwave recordings to figure out how different parts of the brain are communicating with each other, find abnormal patterns, and teach people to correct it. So, one of the things that we have found is that people who have chronic pain very often have very different brainwave patterns than people who don't. So, one of the things we begin working on is how to teach people to correct those problems. So, what you have is peripheral problems like decreased blood flow causing a lot of the pain, and you have problems in how the pain is interpreted by the brain. So, I'm not saying it's all in your head as an imaginary, it's a processing problem that people can learn to correct. So again, there's we can look at brain waves, we can look at blood flow, we can look at muscle tension, we can look at a lot of stress responses. So for instance, when people get nervous, they sweat more. So we can begin to get an idea of what's getting people nervous by recording their sweating, their heart rate, things like that, and pick up things that make you nervous that you don't realize make you nervous until you see these responses. And then we teach people to recognize, aha, that's what's making you nervous. And we can teach people to correct it by helping them breathe better or work on their problem. Look, a good example is, let's say somebody is phobic about snakes. The basic treatment for phobias for things like snakes is called progressive desensitization, where first you have a person imagine a snake being in the room, but there's no snake in the room. And when they stop getting nervous about that, then you can bring a stuffed snake into the room. And when they stop getting nervous about that, you can bring a real snake into the room. And, you're getting them used to it without their having a stress response. The problem is the therapist and the patient don't know when the stress response actually stops. You do a psychophysiological recording and see when they're not reacting anymore. So
I
that was
see.
finishing off your first
Yes.
question. Can we go back to the second one now?
I
Which I
love
forgot
that.
already.
Yeah, yeah. So basically, I was curious as far as how you can kind of tease out whether there's a component that's under our physiological control that we can modify it with these different biofeedback techniques versus something that is more of a biological, like, inflammatory issue that maybe
Got it.
you can't. Are there times where it's kind of both? And
Yes, it almost always is both. Uh, um, when your body is hurting, your muscles tense up in the area where you've got the pain. So that magnifies the pain, say, due to arthritis tremendously. So by, first of all, finding out that there is a muscle tension component, we can reduce the total amount of pain by helping people control the muscle tension. For people who have processing problems with the pain, in other words, let's say the arthritis is causing this much pain, but you're processing, the way you process the pain magnifies it out to that, we can help them learn to get it down. But we can't do anything about the arthritis itself. We can help them not have as much stress response. So it's always a combination of different things, but at least you're not going in blind. Let's say a coach is trying to figure out why an athlete isn't running as fast as they really should be. We record their respiration as they're running, and we find out whether they're breathing correctly and train them to breathe better. But if they have a obstructive problem, we can't correct that, but we can tease out what's making it worse. And very often it's just plain breathing problems that are causing the problem. And a good example is anxiety. People who have just plain anxiety all the time, they're usually anxious, but you can't pin down what's really causing it. For a minority of those people, they habitually breathe wrong all the time, which sets off a fight-flight response, but a very, very low-level one, which makes you anxious all the time. So what we do is record people's breathing problems. And if it turns out there's a relationship between poor breathing and anxiety, when we train them to breathe correctly, most of the breathing related anxiety goes away without any further treatment. So you're not doing psychotherapy at this point. You're correcting the problem by correcting the breathing.
Right.
Obviously, you need cognitive restructuring and other interventions if there are reasons for the person to be very anxious.
Right. Do you see it sort of as, if someone is physiologically anxious, that it's going to cause, something like anxiety? Do you kind of see that as like kind of going to the root of the issue of sort of correcting the physiology, and then in turn the psychology will follow, or
Yes, very, very much so. But remember that this is limited. It's limited to those people where the anxiety is due to a breathing disorder. It's not going to have any effect on people who are anxious for other reasons, who are breathing perfectly well. Um,
interesting?
but the pain, the anxiety goes away right away with these people. It's amazing. Once they habitually breathe correctly, um, that free floating anxiety is gone. But again, a minority of people, and they have to have that problem. An example of pain going away very, very quickly is with phantom limb pain. If people have incorrect muscle tension in the stump, they may have been hurting for 20 years. Horrible, horrible pain. If it turns out that the pain they're feeling, which usually is a cramping sensation for people who have a problem with muscle tension, as soon as they learn to control that, the phantom pain's gone. So something that's been an agony for decades for people is simply gone with no other intervention. And that's one of the strengths of a psychophysiological recording, figuring out what's going on, and feedback being used to coach people to correct the problem.
Right, right. Let's go back to something that you touched on briefly earlier about, as far as looking at the brain waves. So is that, can you kind of tell me, I think we were talking about that in relation to, was it migraine headaches? Um, but what sort of conditions, physiological conditions, do you see kind of the abnormal brain waves in, and then what do you do about it?
Um, there's two directions on that. One is simply different processing, so not abnormal, just different processing. A great many people with fibromyalgia have, they have agonizing levels of pain. One of the reasons the pain is at an agonizing level is they're processing the information that comes up from the body into the brain differently than other people. So when you see those different patterns of processing, you can help them reduce that and change to more normal levels. That's not something that has been proven in double-blind studies to be efficacious yet. That's research going on. There's much better evidence for problems like ADHD in children with math problems. So if you have a child who simply can't focus and can't sit still, um, they have a difference in brainwave patterns that you can fairly easily detect and then train people to change. Kids are wonderful about this. So again, find what is abnormal. In this case, we're talking about an abnormal problem, not a processing problem, and teach them to normalize it. But you have to make that into a habit. This isn't, you're not sending anything into the body that instantly cures the person. The person is learning to recognize um, an incorrect pattern of brain waves and change them to fix the problem. But then the person has to keep it changed. That's the next key point with things like ADHD.
Right, right. And is that something, I'm curious actually, is that something that usually requires kind of continual practice, or are there certain times, you could train someone to process something different physiologically, and then they're able to just, that's their new baseline. They're able to operate like that from then on, or
Well,
is it continual practice?
thankfully, there's actually good studies on this. So let's say migraine and tension headaches. Uh, there are excellent double-blind, placebo-controlled, long-term follow-up studies that demonstrate efficacy of biofeedback-based interventions. And in comparison with any preventive medicine, they're at least as efficacious. So um, you've got an initial change. But it turns out that for most people, they need a brush up every once in a while to keep their skills up. If you keep the skills up, you do a lot better than if you don't keep the skills up because the problem creeps back.
Right. Yeah,
However,
one of
you do that yourself. You don't have to come into a clinic for that.
Sure. Well, one of the things I've just been thinking about lately is, kind of the idea that our bodies and brains are so kind of programmed to operate the way that they are. If someone has been dealing with something for a long time, and they're so used to functioning at a certain level, it seems like and then they're suddenly introduced to this new way of functioning. Does there tend to be the problem where people sort of just revert back to the old ways?
Of
Um,
course, that's why you have to keep practicing your skills if this is going to be maintained. Otherwise, you may very well revert. Also, you'll forget how you were doing it. Um, one example would be breathing um, correctly. If let's say that you breathe too quickly and shallowly, that causes anxiety, as I mentioned. Um, your heart, the variability between heartbeats, heart rate variability, tends to be very low for people with a lot of anxiety. Heart rate variability affects how your gastrointestinal system reacts, so that you can have a lot of anxiety related to intestinal problems. But if you can learn to control your heart rate variability so that you increase it an appropriate level, you can't have certain anxiety reactions because the two parts of the body just can't work separately. So if you develop good heart rate variability by learning how to breathe correctly or having heart rate variability feedback, the person becomes less anxious. But if you train somebody to have good heart rate variability, there's no evidence actually out there that heart rate variability remains changed when somebody becomes anxious. So you have to apply your skills and practice it. So good assessment, good intervention, it works, and then it doesn't work anymore if you don't practice it for a great many people. For others, they seem to internalize it, keep right going, right on going.
Interesting. Okay. So your job, kind of. or someone's job kind of as an applied psychophysiologist, it seems like there's a lot of kind of investigational work that is going to go into it, right? To kind of figure out, you know, what what areas of the body are causing, whatever kind of problems that are occurring, and then specifically, what is actually going on. Is that
That's right. You're a detective. Nothing's
Mhm.
ever simple. Nothing's ever caused by one specific problem. Real real people are complicated. They've had problems that have developed over time. And just like any clinician, it's your job to tease it out, figure out which parts you can help, which parts you can't. However, this is not necessarily a clinical field because you're doing this with school children who can't sit still or concentrate. You're doing it with soldiers who develop back pain um, as they're in combat and combat exercises. You're doing it with athletes who simply aren't doing as well as they could. So the military pours many, many millions of dollars a year into optimal functioning training. Virtually all of the major Olympic teams have uh, psychophysiological evaluations and psychophysiological type people on their staffs now. There's almost no major Olympic teams that don't have this. And that's spreading into the professional sports teams and the college level teams. So this is rapidly, rapidly spreading through the sports world and the military world. So
it
don't think of this as just a clinical area.
right.
Major uses are outside of clinical, and when it's used clinically, it's used in areas that you wouldn't expect, like for urinary incontinence, where women that are playing sports get trained really outside the clinical environment to control their muscles better.
Hmm.
But when you're doing all this, you have to be careful as you slide over from somebody who's not functioning optimally into somebody that's broken, where it's a clinical diagnosis. If it's a clinical diagnosis, you've got to have a license to do this, a state license to assess and intervene with that kind of a problem.
Right.
So you
Well,
don't treat headaches without a license, for instance, but you certainly do treat breathing problems for a runner without a license. That's coaching.
sure. What about as far as, you mentioned the applications that are going on in the military and the athletic worlds. What about, with the business world, or as far as, all of the stuff, that we know now with neuromodulation and neurofeedback, um, that do you think that's kind of the next frontier as far as, if businesses are able to realize that if we're able to get our employees' brains functioning better and have more productivity and more work output, there seems to be vastly more money that could be made. What what are your thoughts about that?
Um, that gets to be a complicated question. You're right. You can use brain waves. Very often, people in business really can't think clearly because they've stopped breathing correctly, or they're so tense that they get pain all the time and then they can't function in their jobs. So it's more than just brain waves, but all of it together you need to tease out. Um, One of the things that happens uh, in business for people who sit at computers all the time is if they don't take micro breaks, they wind up with all kinds of aches and pains. So um, very often, the simplest intervention is just a timer on the computer that reminds you to take a micro break, or a little breathing pacer that's up in the corner of your screen so that you remind yourself to breathe properly. But you have to remember that very often there's something causing the anxiety. So if let's say that you're doing translations for people who are deaf, if you're making signs, if you don't take a break, you'll bust yourself. Micro breaks are extremely important. But in the business world, you have to always be looking at, if somebody is anxious, why are they anxious? You have to begin teasing that out. And most people by now have heard of the toxic boss syndrome, where you've got a boss who is not necessarily an evil person. They just don't realize the impact that their style is having on their employees. And toxic bosses have very unhappy people, high turnovers, very, very high levels of sickness. So you don't use psychophysiology just to figure out that there's a toxic boss. You have to retrain the toxic boss. In other words, if you're going to help the worker, you're going to have to get the boss functioning better. And psychophysiology is a part of that, but so is many, many other techniques. So this doesn't stand alone. In other words, having a breathing pacer isn't the answer. It's finding out, why did you need that breathing pacer in the first place?
Right. I something I want to I think
Yeah.
really interesting thing that you brought up. What I want to ask about is like, say, you gave the example of a toxic boss, but people, there's people all around the world, who all in our worlds who are causing us, stress, and they've got all their own issues. Do you see, this sort of biofeedback interventions kind of, and especially actually heart rate variability, can that kind of make us more resilient in terms of actually, being sort of more immune to dealing with all of the stressors around us?
Resiliency is one part of it. Teaching people to be resilient means teaching them to recognize when they're having a response to stress and dealing with it. But that's not just psychophysiology. That's things like cognitive restructuring, recognizing that somebody that's trying to get you to bake a cake for them every week doesn't control your life. So you can show somebody physiologically what that's doing to them, but then you need other interventions like cognitive restructuring to help them realize that that person doesn't control you. So it's, again, this is a more complicated process than just um, uh, teaching people to control their responses. So the various interventions work together very, very beautifully. An example is irritable bowel syndrome. There are really no medical treatments for irritable bowel syndrome that work better than a placebo. When you watch these ads on TV, they don't really put up in those disclaimers in the back that this works only slightly better than a placebo. Rather than that, you have many decades of very solid research showing that cognitive restructuring used along with biofeedback really is effective for that problem, because irritable bowel is usually caused by chronic stress responses, where you're interpreting the stressors wrong. So again, things like cognitive restructuring, extremely successful at helping most people with irritable bowel. When you add psychophysiological evidence of how they're functioning, they do even better and even more quickly. So biofeedback helps tremendously by helping people learn to track their responses, when things are going wrong.
Right.
So yes, breathing retraining, that helps tremendously. Getting to the root of the problem, that's where psychophysiology's strength is. And biofeedback strength is helping people learn to correct it. And let,
Right.
let me emphasize that nothing goes to the person. Sometimes you'll hear about people claiming to do biofeedback, and it's some kind of a machine that records some kind of magic blood problems um, from outside the body, and then the machine feeds something back into you to fix it. That's not what we're talking about here. And there's also no evidence that those things do anything.
I see.
We're talking about a teaching um, regime.
Right. And it sounds like, I mean, there's so many applications for this, so many applied and clinical applications for this. I think this is a good transition to kind of talk about, your role as kind of, a director um, of the doctorate in applied psychophysiology and the masters of science in psychophysiology, those programs at Saybrook University. Can you tell me like a little about, who who might be a good fit for those programs, or what those programs can offer, people as far as career opportunities down the road, since it seems like the
Absolutely.
possibilities are really kind of almost limitless.
So, just like with everything else you've asked, it's a more complicated question than you would think. Um, People who are real professionals in their own area can add psychophysiological assessments and interventions if it's within their own scope of practice, whether it's coaching or education or clinical areas. So they can get really good training in these areas, but it's very, very limited. In other words, they don't have the depth and the breadth to tackle a wide variety of problems. They can only tackle very successfully a very narrow area. The reason that people need to go beyond basic education in things like psychophysiology and biofeedback is there are so many different aspects to the field. There are so many different areas that you can work in. But if you don't have the depth of understanding of what's going on in the body, what causes different problems, how to do professional level recordings, how to teach people to change them. So this is width and depth. And many people don't need that. But if you really want to go into this in a professional way, so let's say you're a coach, a sports coach, you can learn a little bit about breathing and heart rate variability and help your people to some extent. But if you want to work at the Olympic level or the professional sports level, if you want to be effective working with college level athletes, you need to be able to do more assessments than just breathing and heart rate and maybe some muscle tension. And you have to have a much better understanding of what's happening with the body as people do different kinds of exercises. In other words, when are you breaking somebody? So you need the depth and again, the width to pick up these problems. Same thing in the clinical world. So we have master's degrees where people get that breadth and depth. We have a general master's in psychophysiology, and we have that includes coaching. but now we're starting an entirely separate master's in optimal functioning in sports and performing arts for
Mm,
people who need to coach high-level performers. So these are the people who are getting the skills where they can make tremendous differences. And they're the ones who teach the other folks, the folks with the limited amount of knowledge, whether they're doing something right, how to do it better. And they're the ones where, when an initial evaluation doesn't work out, that's the people that you send, the coaches, the regular coaches would send people to, their
right.
athletes to, or their school children to.
That
Um,
makes a lot of sense because, I mean, you wouldn't, especially if you're, in charge of a pro sports team or, we talked about the Olympics, it's like you wouldn't want just anyone off the street who can claim that they can, do these biofeedback interventions. I mean, you would want someone just as, an employer in some other field would want someone, with a degree, from a good
right.
university. It seems to make a lot of sense that with this new field, there's I mean, there's bound to be so many charlatans, and there probably already are, people who are making all these false claims about biofeedback and what they can do with it. So the way I see it is a program like yours is kind of, can kind of clear out some space and kind of direct people in the right direction who really want effective research proven techniques.
Thank you. You're selling it. Yes, that's exactly the situation. But rather than thinking of charlatans, and there's a huge number of charlatans out there, just as you said, what's worse is there are a lot of people who buy biofeedback equipment and have no training in using it, so they make matters worse or are completely ineffective. So that's a major problem that we have to watch for. And there are some organizations that will certify people to have a basic understanding of how to do very, very limited interventions. The Biofeedback Certification International Alliance is one, BCIA. If you get enough training to know a little bit about what you're doing in a very limited area, you can get certified where they'll say, yep, you ought to be able to do that. And that's a lot better than having somebody who has absolutely no idea what they're doing. But again, the people with the master's degrees are the ones that can sort out what is happening.
Right.
Let me give you an example of that. Let's say you've got a musician, um, and they're playing an instrument that requires using the fingers like this all the time. If you're a high-level musician, you practice hours and hours and hours a day. And by making these changes, you change your brain so that very often two fingers won't move separately anymore. You have to use a essentially an evaluation of the brain waves to figure out what's wrong in the motor strip and teach people to change it. So people who have basic training in areas like EEG and biofeedback simply do not have that level of skill. That's where you need something, at least a master's.
Hmm.
However, the master's is also limited. These are more technical kinds of people. They don't have all the depth and breadth they need to be true professionals in psychophysiology, and they aren't professional researchers. So proving that psychophysiological assessments and psychophysiological interventions such as biofeedback actually work, take people trained at the doctoral level so you have enough depth and breadth of knowledge to do good research in the field. So anyone who's got an idea that some kind of an intervention or some kind of an assessment might work, um, really can't do it without working with a professional doctoral level psychophysiologist or going ahead and getting a doctorate on their own. So again, for the doctorate, you have even more depth and breadth of understanding, but you're trained in how to do excellent research in psychophysiology. So the techniques you need to do research in psychophysiology are very, very different than the research skills you need for psychology or business, um, or really any of the other fields. It takes specialized understanding of what the signals from your body are doing, what the equipment's capabilities are. In other words, what are you actually recording as opposed to what is going on in the body? Uh,
Right.
so that takes a doctoral level person. And when you have a doctorate in a field like psychophysiology, you can work in a university as a professor. You can work in various kinds of research facilities or clinical facilities um, using this greater knowledge. In other words, you're a doctoral level person, but this field is not licensed. So we only take people into our doctoral program who want to do clinical work, who already have a master's level license. So they're going to continue using their master's level license, but adding all of this extra knowledge to it. If they're not working in the clinical environment, like if they're in business or the military or education or sports, then they don't need a license, certainly, but they have this huge depth of knowledge of what's happening in the body, so that they can be true professionals helping out. And that's really what you want. If you're going to employ somebody to fix a severe problem in your field, you want somebody with all the depth and breadth that you can get, and somebody who's trained in research so that you can prove that it's working.
Yeah.
Remember that if you look at psychological interventions and if you look at medical interventions, a great many of them that are very well accepted don't do anything. They simply don't. Then research comes out and some technique that's been in use for a decade, was not actually doing anything. So you really want to avoid that. You don't need to add that to your other problems. So you want somebody who is capable of figuring out from reading the literature that exists whether something really works, and they can do their own research to figure it out.
Right. Now let's talk about I want to kind of conclude the discussion by kind of talking about where's the future of this field going? Where both from kind of an educational standpoint, it seems like, there's going to be more of these programs that are going to pop up, or at least these different certifications are going to become much more well known about and more well respected amongst, I think, like the greater uh, population, for lack of a better word. But what, as far as other applications, just what excites you about where the field is moving?
The field is broadening its reach so that the certification groups right now uh, don't cover all the different areas, but there's also very limited research. As the research grows in depth and in be able to actually prove efficacy, that's what's getting the field to grow tremendously. Um, for instance, our early work with muscle-related urinary incontinence started as research. People were claiming that you could use muscle tension biofeedback to help people with urinary incontinence, but there was no proof. So we started doing very solid studies that proved what was going on in the body and proved that the various interventions worked. So now the federal government doesn't consider this experimental, and groups like Medicaid pay for it, and in fact insist that this be accepted. In other words, this is a treatment that you have to uh, pay for and provide. It's not completely optional. Groups, professional clinical groups are accepting psychophysiological interventions like biofeedback for specific problems like pediatric headache as the recommended treatment to start with, not pills. So big groups are starting to say, start with this because there's the evidence that this works and it doesn't have the side effects that pills have, especially for children. So that's growing. As the evidence grows, the field is spreading very rapidly. In areas like sports, obviously this is an incredibly competitive area. Anytime the owners of a team or the professional coaches get the idea that they can get even a sliver of an advantage, they're going to try it. And then if it seems to work, and then if there's actual evidence proving that it works, they're trying it. So this area is spreading very, very quickly through areas that have to perform optimally, like the military and the sports groups. And the chances are that as research shows that this really works very, very well, the field will continue to expand. And as there's more research, it's easier to separate out the people who don't know what they're doing with their equipment from those who do, because there are protocols that you can apply that are known to work. And it helps reduce the number of charlatans that are out there, who claim that if you put a magnet on your forehead, that'll help you run better or something like that.
Mm-hmm.
Because they don't have the evidence, and our field is rapidly gaining more evidence.
Right.
What we don't have are master's programs spreading very rapidly. So right now there are programs that have concentrations in biofeedback or applied psychophysiology, but not freestanding masters other than the ones at Saybrook. And we have the only doctorate right now in applied psychophysiology. And I think that's going to change. I think there's going to be a lot more master's programs because people are realizing that they can make a very good living from this if they have a master's. So I look forward to more and more master's programs coming up. And then as people want to do research in the area or use doctorates to raise themselves in their own professional fields, I'm hoping that there'll be more doctoral programs as well, but that'll be a little slower.
Awesome. Awesome. Well, that's super exciting, and I can't wait to see, what ends up coming with the field. Um, Dr. Sherman, it's been a pleasure having you as a guest today. I've really enjoyed our discussion. Do you have any resources that you would point people to if they want to learn more, either about your research or, Saybrook or Behavioral Medicine Foundation? Are there any links or places you would direct people to?
We can, I can provide a website that'll link to these different areas.
Awesome.
we never mentioned continuing education training. There are a number of organizations that provide continuing education, CE, for biofeedback and other behavioral medicine techniques. So one of those is the Behavioral Medicine Research and Training Foundation, which is a nonprofit, so it can provide inexpensive training in these various areas. And that's the website link I'd like to give people, because on that website, you can get directed to Saybrook's Master's and Doctoral Program and to various other resources.
Awesome.
So
We will include that.
the easiest way to remember that is biofeedbacktraining.org.
Sweet. Awesome. All right. Well, Dr. Sherman, thank you so much again for coming on the show today. If you guys enjoyed the show, please like and subscribe to our YouTube channel. That's Roscoe's Wetsuit. We're also on Instagram at Roscoe's Wetsuit Podcast. Go ahead and follow us. You can also listen to the audio version of the podcast on Apple Podcasts as well as Spotify. So, whatever format you enjoy, go check it out. All right. Thanks again, Dr. Sherman.
Okay. Thank you very much for inviting me to be on.
Absolutely.